Hi, I'm Dr. Pinal with Oral Surgery Associates of Colorado Springs. Today I'd like to talk to you about wisdom teeth. Wisdom teeth are the last teeth to develop in your mouth. They start to erupt around age 17 to 25, or the age of wisdom, hence their name. Oftentimes, wisdom teeth are impacted. Impacted wisdom teeth means that they don't have enough room to fully erupt into the mouth to become good, usable, serviceable teeth. About 90% of people have at least one impacted wisdom tooth. For most people, the best time to remove wisdom teeth is in your late teens. Typically, the consultation happens hopefully between age 15 and 18. At that stage, the patient's wisdom teeth are in an early stages of development and the roots are not yet fully formed. The advantage of removing wisdom teeth before full formation of the roots is that the teeth are smaller, which leaves a smaller hole in the patient, which is less traumatic, and also they're not as close to important structures such as your sinuses and your nerve. Typically, when most patients do have their wisdom teeth removed, they go to sleep to do it, and we do in-office intravenous sedation for most of our patients. Why would you want to remove your wisdom teeth? Primarily because they usually cannot erupt into the mouth to become healthy teeth. Partial eruption of teeth can be quite dangerous. They can expose themselves into the mouth, which is full of bacteria, and the bacteria can then get in around the wisdom teeth and cause significant infection. That infection can lead to gum disease, periodontal disease, bone loss, loss of the wisdom teeth and neighboring teeth. It also can become a serious infection. People who do get wisdom teeth infections can end up getting septic, and infections can get into their bloodstream and damage organs such as your heart, liver, kidneys, and things of that nature. Also, wisdom teeth that are left in place can easily decay. They're very difficult to clean, and they decay easily. The other thing that can happen with impacted wisdom teeth occasionally is there can get cysts or tumors that develop around the wisdom tooth and cause significant erosion and hollowing out of the jaw. Occasionally, wisdom teeth can be serviceable and functioning teeth, and it isn't always that they need to be removed. Generally, they have to fully erupt, be disease-free, symptom-free, and no decay. They do require constant maintenance and monitoring and should be watched at least every year to make sure that they don't develop any kind of problems. Wisdom teeth surgery usually takes around 45 minutes or an hour, and typically plan to be in the office for about an hour and a half or so. That's enough time to have to bring the patient back, get them off to sleep, do the procedure, wake up, and be safe enough to go home with their parents or significant others or friends. This is an example of a panoramic x-ray which shows 4 impacted wisdom teeth. The wisdom teeth are on each of these corners on both sides. Other anatomic structures are the maxillary sinus up in this space and here. That's all hollow space. That's living up in this area here. When we remove the upper wisdom teeth, there can be a hole that remains in the upper sinus. Typically, patients who are nice, young, and healthy, they close by themselves with little intervention required, if any. Also, there's a nerve that runs through the lower jaw, comes out and exits here. It's the same thing on this side. That nerve is a sensory nerve. It runs the feeling of the lower lip and chin. It's not a motor nerve, but it is a sensory nerve. Behind that, there's a nerve that runs the feeling of the tongue. During wisdom teeth surgery, while patients are asleep, I numb up all of these nerves. So when you wake up from surgery, your lower lip, your chin, your tongue, your cheeks will all be nice and numb, and you'll be numb for the whole day. That keeps you ahead of the pain, and you're not uncomfortable when you wake up. We talk about that nerve because of the proximity. These roots on the lower wisdom teeth are close to that nerve, which is a normal anatomical position. So when those teeth are removed, there has to be pressure applied to the teeth to get them out. When that happens, it is possible to bump or bruise that nerve. A bumped or bruised nerve responds like a bruise somewhere else. It hurts. And that nerve that's injured temporarily can produce some numbness or tingling that lower lip, chin, or even the tongue. Typically, that only lasts the first day. However, it can persist for weeks to months, which is quite unlikely. In rare instances, it is potentially permanent. That is another good reason to remove wisdom teeth when the patient is young and there's not full development of these roots. If you can imagine this tooth being impacted, there isn't room for the crown of this tooth to come into the mouth. And as this stays here, the roots just develop longer and get closer and closer to that nerve. Likewise in the sinus, when this is impacted here, these roots go closer and up farther into that sinus. Both of those risks can be reduced significantly by taking out the wisdom teeth in that age of the 15 to 18 range. It is true that the ideal time to remove wisdom teeth are in young folks. However, if you are older and still have wisdom teeth, generally we don't remove them unless they become symptomatic. After the age of 30, there are certainly opportunities to remove them, specifically if you start to develop pain, periodontal disease, crowding from the other teeth, or of course cysts or tumors. That will necessitate the removal and certainly can be done at any age. We take out wisdom teeth as early as 12 or 13 all the way up to 90 years old. If the tooth is hurting you, it needs to be removed. It still can be done with local anesthetic or IV sedation, and generally we only remove the symptomatic teeth after the age of 30. I'd be happy to talk with you about it at any time. Please give us a call to schedule a consultation.